Good morning. Today we will tackle about body movements. There are general anatomical terms that can be used to describe most movement the body makes. Most terms have a clear opposite and so are treated in pairs. These pairs include flexion and extension, abduction and adduction, circumduction, elevation and depression, internal or medial rotation, external and lateral rotation, dorsiflexion and plantar flexion, pronation and supination, inversion and eversion, protrusion or protraction, reclusion or retraction, opposition or reposition. Flexion and extension. Flexion and extension describe movements that affect the angle between two parts of the body. Flexion describes a bending movement that decreases the angle between a segment and its proximal segment, while the extension is the opposite of the flexion, describing a straightening movement that increases the angle between body parts. Example, when we are performing this is the flexion and the extension is this, and in hands, this is the flexion and the extension is this. That's all.
Abduction and adduction. Abduction is the motion of a structure away from the midline, while adduction refers to motion towards the center of the body. The center of the body is defined as the mid-sagittal plane. These terms come from Latin words with similar meanings, ab being the Latin prefix indicating away, ad indicating toward, and ducer meaning to draw or pull. Abduction refers to a motion that pulls a structure or part away from the midline of the body. In the case of fingers and toes, it refers to spreading the digits apart away from the center line of the hand or foot. Abduction refers to a motion that pulls a structure or part toward the midline of the body or towards the midline of a limb.
Wala naman napakita to kuan.
Abduction. This is the example of adduction and adduction.
Circumduction. Circumduction refers to a conical movement of a body part, such as a ball socket joint or the eye. Circumduction is a combination of flexion, extension, adduction, and abduction. Circumduction can be best performed at ball and socket joints, such as the hip and shoulder, but may also be performed by other parts of the body, such as fingers, hands, feet, and head. This is an example of circumduction.
Next is elevation and depression. The terms elevation and depression refers to the movement above and below the horizontal. Elevation refers to movement in superior direction. Depression refers to movement in an inferior direction, the opposite of elevation. This is the example of depression and elevation. Internal medial rotation and external lateral rotation. Rotation of body parts is referred to as internal or external, referring to rotation towards or away from the center of the body. Internal rotation or medial rotation refers to rotation towards the axis of the body. External rotation or lateral rotation refers to rotation away from the center of the body. This is the example of rotation, lateral rotation, and medial rotation. Flexion and plantar flexion. Dorsiflexion and plantar flexion refer to extension of flexion of the foot at the ankle. This term refers to flexion in direction of the back of the foot. Dorsum pedi, which is the upper surface of the foot when standing, and flexion in direction of the sole of the foot, plantar pedi. These terms are used to resolve confusion as technically extension of the joint refers to dorsiflexion, which could be considered counterintuitive as the motion reduces the angle between the foot and the leg. Dorsiflexion is where the toes are brought closer to the shin. This decreases the angle between the dorsum of the foot and the leg. Plantar flexion or plantar flexion is the movement which decreases the angle between the sole of the foot and the back of the leg. An example of dorsiflexion is dorsiflexion and plantar flexion.
Pronation and supination. Pronation and supination refer most generally to assuming prone or supine positions, but often they are used in a specific sense, referring to a rotation of the forearm or foot so that in the standard anatomical position, the palm or sole is facing anteriorly, supination, or posteriorly, pronation. Pronation at the forearm is a rational movement where the hand and upper arm are turned inwards. Pronation of the foot refers to the turning of the sole outwards so that weight is borne on the medial part of the foot. Supination of the forearm occurs when the forearm or thumb are rotated outwards. Supination of the foot refers to the turning of the sole of the foot inwards, shifting weight to the lateral edge. This is an example of prone and supine.
Go.
This is an example of pronation and supination.
Inversion and eversion. Inversion and eversion refers to movement that tells the sole of the body foot away from eversion of the wide inversion, the midline of the body. Eversion is the movement of the sole of the foot away from the median plane. Inversion is the movement of the sole toward the median plane. This is the example of inversion and eversion. Inversion, eversion.
Protrusion or protraction and retrusion or retraction. Protrusion and retrusion are sometimes used to describe the anterior or protrusion and posterior or retrusion movement of the jaw. Protraction and retraction refer to an anterior or protraction or posterior retraction movements such as the arm and the shoulders and the mandible. So this is the example of retrusion of mandible or protrusion of mandible.
And reposition. Opposition refers to the movement that involves grasping of the thumb and fingers. Reposition refers to restoring an object to its natural condition. This is the example of opposition.